So today I wanted to show you guys something, and I think it's a good skill most breeders should know about. And really what it is I have larger pills, antibiotic that I need to give to one of the puppies. And how do I break the dosage down so that then I can give it to the smaller puppy? Well, maybe you have medication, antibiotics, whatever the case may be, and it's for larger dogs, or it's for bigger, it's for bigger weights, and you want to go ahead and cut it down, but it's a pill form. So how would you break down the dosages? How do you break down the dosage to give to smaller dogs, things like that? So that's what we're going to talk about today, so stay tuned. All right, Bully fam. So what we're doing today is I have a puppy. She's got a little bit of an upper respiratory going on. So what I use is doxycycline. I have her on some Clavamox, and I'm going to give her some doxycycline, right? So I mind you guys, when I do these videos, I'm not a vet. I'm just a breeder that's been doing this for quite some time, and this is the stuff that we do here. Any medical advice, anything like that, take it up with your vet. So this is just what we do. So anyway, so I have these pills, right? They're 100 milligram pills, right, of doxycycline. I'm not going to get into too much about like dosages for all kinds of different antibiotics and things like that. This is just purely for like educational purposes and showing you guys what I do and what I would do. So don't mind that it's doxycycline and the dosage and things like that. I want to give you guys the frame of mind that I go into when I'm breaking the dosage down on a pill like this. So it's 100 milligrams of doxycycline. 100 milligrams is too much. That would treat about, at least for what we do here, it would treat about 20 to 25 pounds. So what we want to treat is only 5 pounds. The puppy's about 5 pounds. So what we want to treat is significantly less. We want to give the puppy about 25 milligrams. Well, we have a problem because the way these pills are, they're just large capsules with powder inside. So I'm gonna show you guys real quick. Looks like this. I don't know if you can see. But that's what this looks like. So what do you do? So pretty much I'm gonna show you guys real quick what I do, so that then we could go ahead and take this 100 milligram tablet and pill and turn it into our 25 milligrams that we need, which is 1/4 of 100 milligrams to give to the puppy for the upper respiratory. So let me show you guys. All right, guys. So like I was saying, this is what I do when I need to go ahead and take a pill that's for a higher, that's a higher dosage for a bigger dog, and get it down to for a smaller size, instead of having to go ahead and purchase the smaller dosage. This is what I do. Whether maybe you don't have vet available at the time, whatever the case may be, to get the smaller dosage, or just to save some money, whatever the case may be, right? So like I was saying, the doxycycline is 100 milligrams, and we only want 25 milligrams. So 1/4 of 100 milligrams. 25. So I'm gonna take one out and just show you guys real quick, right? So here's the doxy, right? So now what I'll do is I'll go ahead and I'll take a blade. I'll take a blade like this, and all I'm going to do is go ahead now and open the capsule, right? So that's all you're gonna do. You probably could even do it with your finger. I mean, it all depends. Each one is different. But anyway, so all right, I'm gonna go ahead and open this up and put this right here in the space. Make sure everything is out. And as you can see, we got all the powder right here, right? All the antibiotic right here. So this is the casing. We really don't need this anymore. What you're gonna do is take your blade, or you can take a card or whatever the case may be, just to keep it all contained. So now what you're essentially gonna do, it looks like you're cutting up drugs, but all you're doing is taking the antibiotic, right? And now what you're gonna wanna do with it is you're gonna want to kind of try to make an even line, right? You're gonna try to make it as even as possible, as well as vertically on top as well. Try to make it all even, just like this. There we go. And you're just gonna make your even line. And I don't know if you guys can see how even this looks. This looks pretty even. But anyway, so all right, so we have our even line, right? Let me skim off some here. Just fix this up real quick. So, have our nice even line, right? So, we know that this is 100 milligrams. So, as I said, if you divide 100 by 4, each part would be 25. So, all you got to do is try to eyeball it as close as possible to 4 even cuts. So there we go. Pretty spot on, if you ask me. 4 even cuts. So now, because this is something that we give morning and at night, and like I said, the aspect of what it is and the dosage isn't as important as, like I tell you guys, the mindset. So now if I have a pill that's 300, or let's say, make the math simple, let's say I have a pill that's 400 milligrams and I need to divide it into 100 milligram parts, this is exactly how you would do it. And instead, each piece would be 100, 100, 100, 100. 100 milligrams per cut. So all depending on, it takes a little bit of math. Like I said, that's what we have to do here. 100 milligrams divided by 4 came out to what? And actually, I could go right down the middle and it would divvy it up into 8 parts. Now you would just do 100 milligrams divided by 8 individual even pieces. There goes your math. So it's a little bit of math, but I mean, hey, it'll save you a lot of money, a lot of headache, can potentially help your dog if you're in a dire need to give them some antibiotics right away, some medicine right away. And you know what, the most important thing I would say when doing something like this is just knowing what is the dosage as far as milligram per pound. If you can find out what the milligram per pound is, like for example with this, I know that it is about 5 milligrams per pound that you dose. So it makes it easier for me as far as, okay, so I need to divide it up by this amount to be able to treat this amount of weight per dog. 5 milligrams per pound, we want to treat 5 pounds. So you would do 5 times 5, which is 25. So we would need 25 milligrams. So that's why, like I said, we took the 100 milligrams divided by 4. Hopefully that's not confusing. So anyway, so now just to show you guys a little bonus tip. So this is all you would give. You would give this to the dog, the puppy, and that is it. Got your 4 individual pieces. And now you don't really even have to waste this all. Or let's just say you have 4 different puppies. Give each one their 25 milligrams, whatever. What I'm about to do is I'm gonna give 1 and then I'll save the other 3 for later. But let me show you guys as a bonus trick what I do and how to give it to them now that it's in this powder form, right? So now that it's in this powder form, you have a couple options. So depending on the medicine, some antibiotics and some medicines can't or they suggest not to be I guess like dissolved with water. So you have to be mindful of that. This is what I think is going to be the easiest for a lot of people, to each his own. I like NutriCal. So what I'll do is I'll take some NutriCal, and hopefully there's enough in here to show you guys, or some peanut butter. NutriCal or peanut butter. I think no matter what, every breeder should have NutriCal in their arsenal, in their shelf. Maybe I'll do an episode going more into detail as to why, but long story short, NutriCal is like super important. I mean, it's damn near it can be life-saving at times if the dog isn't getting enough calories in, and I'll say that for another episode. But anyway, so what I'll do is, for educational sake, we're gonna go ahead and actually, I'm gonna just move these out of the way, right? These out of the way. So we have the 1 part left. This is 25 milligrams, and it may be off by a few milligrams, give or take. Like I said, you know, but we're pretty spot on. So I'm gonna go ahead now and I'm gonna take a ball of NutriCal, and then I just try to, because it's super sticky already, I just try to dab it and get as much on the NutriCal as possible. You know, as you can see, it's pretty much picking up almost everything. And if I have to, which I'll show you guys now, just put it on my finger. And if I have to, I'll get a little bit more. Get a little bit more to pick up the rest. Let me get up. That's why I put on gloves, because it gets a little bit sticky and a little bit messy. Here we go. Pick this all up. And now what I'll do is I'll go ahead and I'll take the puppy and just put this right on the roof of the puppy's mouth, you know? Give me 2 seconds, I'll show you guys. Now, I mind you guys, the taste of this is absolutely horrible. But with the NutriCal, which you guys will see, here you go, Mars. She eats it right off my hand. You try to give any powdered antibiotic to a puppy, it's not gonna happen. But she will sit here and literally lick this right off my hand, you know, which makes it a lot easier for me and makes it a little bit enjoyable for her. So that's just what I do. I'll even, like I said, I can try peanut butter. I don't really like using the syringe with water. Oh, let me get her up so you guys can see. But like I said, I mean, she'll sit here and just look away at my hand. She want to play right now. But yeah, I just figured I'd show you guys real quick. And off of that serving alone, look, pretty much all gone. Off of that serving alone, that's about 25 milligrams that she got. So she's gonna get that in the morning as well as at night. And that's pretty much it. So I hope this information was helpful. I hope it was useful. It just goes to show, literally, you can take the biggest of pills and divide it downward so that you could give it to your puppies. Just be mindful of what is the milligram per pound of weight, and you can easily do the math as well. If your vet say they give you a prescription for 5-amox or whatever the case may be, or an amoxicillin, whatever the case may be, and you want to give it to a puppy because it's an emergency, you can easily cut the dosages down. Now, like I said, you know, I'm not a vet. Take this up with your vet. This is just what we do here. Hope the information was helpful. Hope it was useful. See you guys in the next episode of Breeders' Hacks.